All right, so let's check the whole summary of history taking, how we have to take history taking. So let's see in next couple of minutes. So how we start the station, like if you're taking history taking, you just greet your patient, hello, you introduce yourself, you identify a patient, hello, I'm Ankur, one of the doctors here, may I confirm your name? And you'll confirm the name of the patient, you start, maybe patient say, yes, I'm John, you say, hello John, nice to meet you. And then you start the station by putting an open question in front of the patient, how can I help you, right? So always we need to start from the open question. Open question is must. So we are starting with how can I help you, and patient will be telling you some complaint. Why patient is in the hospital? There is something wrong, there is some problem that patient has got. So patient will be telling his or her complaint. Maybe patient has got pain. So what you need to do, you need to put another open question. Tell me more about it. Tell me more about it. As simple as that. Because we want our patient to talk more. We want our patient to give us all the findings. So instead of asking close question or specific question, it's always better to put an open question in front of the patient. Tell me more about it. Tell me more about pain. Tell me more about your shortness of breath. Tell me more about your cough. Right. So this is the way we ask open question. So like for example, for pain, we are doing our mnemonic Socrates, right? We are doing Socrates, and for shortness of breath, for cough, we have got Odipara, right? So when you're asking the patient, tell me more about it, patient will tell you some information, meaning half of the Socrates. If the presenting complaint is pain, patient will do half of your Socrates. And what you need to do, you need to elaborate the full presenting complaint. For example, when you said tell me more, patient has told you about site, about onset, about the character as well. But rest of the thing patient didn't tell you. Now you need to ask close question. You need to ask if it is going anywhere, if there are any exacerbating or relieving factors, or like the severity of the pain and all. So this is what you need to ask. You need to ask close question to finish your Socrates or Odipara respectively. Like depends what is your presenting complaint. Right. So always first we are going with open question and then we are closing the question. So how can I help you? And then tell me more about it. And let's see how much patient is going to tell you. And then you elaborate the presenting complaint by asking all the closed questions. Right. So once you are done with your first presenting complaint, we need to put another open question. Is there anything else? See, patient might be having some other complaints as well. It doesn't mean like when patient is coming to the clinic that they have got only one problem. They might be having multiple problems. They might be having more than one complaint. It's not only chest pain. See, for example, if it is ACS and patient is presenting with the chest complaint, so patient might be having shortness of breath as well. Patient might be having cough as well. Patient might be having nausea, vomiting. Patient might be having tiredness as well. So patient might be giving you some other symptoms as well. So is there anything else? So patient said cough. So which chest pain patient has got cough as well. So what will you do? You say tell me more about it, and let's see how much patient is telling you. And after that you need to elaborate that presenting complaint as well by doing full Odipara, because if it is cough we do Odipara. Right, so keep on doing this thing. So you have elaborated chest pain, you have elaborated cough, and after that the next question will be, is there anything else? Right, so is there anything else? Once patient has given you all the presenting complaint that patient has got, now what you need to do, you need to ask associated symptoms and you need to rule out few differentials. For example, now patient has given the chest pain history to you and patient has told you cough as well. And the chest pain history was very much for ACS. The chest pain history was very much for acute coronary syndrome, and there was dry cough as well. So now what you need to do, you need to ask other questions, other associated symptoms, so that you can prove your diagnosis as acute coronary syndrome. You'll be asking about, say, maybe sweating, you'll be asking about tiredness, nausea, vomiting, because all these things will be there in ACS. And make sure at the same time you are ruling out few differential as well. Ask close question and rule out few differential as well. Make sure the differential you are ruling out, they are emergency and they are like killer differentials. Right, like the differential, if you don't rule out, you might kill the patient. So we don't want that. Meaning you are supposed to rule out few differential, not like so many, maybe 3-4 differentials, they are more than enough, but make sure the differential you are ruling out, it's very important, and few differential by asking close question, you will be ruling out. So that's how you take history. That will be your presenting complaint, your associated symptoms, and your ruling out differential. Right. After that, what you do, you have got your past medical, personal, and social history. So past medical history, you'll ask any previous similar episodes if you have got. And if patient has got any previous similar episode, make sure you elaborate it. Make sure you elaborate it in detail, right? Then you have got medical illness. Have you ever been diagnosed with any medical condition? Have you ever been diagnosed with any medical condition? If yes, then you elaborate it in detail. For example, patient is diabetic. So what you do, you elaborate diabetes in detail. When you were diagnosed, what are you taking? Is it well controlled? So you need to go it in detail. And then medication, you need to ask for medication as well. Are you taking any medication, including over the counter and herbal remedies? Any patient is taking, ask in detail. Why are you taking? Since when you have been taking it, right? Ask about allergies. Are you allergic to something? Are you allergic to any food? Are you allergic to any medication, right? So that's very important. For example, patient is allergic to penicillin, so he'll be very careful offering this penicillin, right? Hospital stay. Have you ever been hospitalized, right? If patient says yes, ask why, what was the reason, how was your stay, elaborate. Surgery. Have you ever had any surgery previously? Ask. If patient says yes, which surgery, why you had, and how was your experience? Did you develop any of the complication? Family history. Family history is very, very important. Ask about family history. Anyone in the family having the same complaint? Anyone in the family? For example, you are dealing with chest pain station and patient said, yes, my father also had heart attack. Ask like at what age he got heart attack, because it's very important, because our patient might also get heart attack in the same age. So we have to be very, very, very careful, right? Then we have got personal history, or I would say lifestyle history. Right. So what you're supposed to ask in this, you're asking about smoking, like do you smoke? So see patient saying yes or no. Ask, have you ever smoked? Maybe patient has quit smoking and the patient says no, and you think it's lung cancer station. So it may not be making much sense. So ask, have you ever smoked? And go it in detail, like what do you smoke, for how long you've been smoking, since when you've been smoking, how often do you smoke, and how much you smoke. So elaborate full smoking. About alcohol, do you drink alcohol? What do you drink? And how often do you drink? And since when you have been drinking. That's it. Diet, what kind of diet you use? Do you include fruits, vegetables in your diet? Physical activity, are you physically active? Do you do proper exercise or daily exercise? Are you stressed? Do you have any stress in your life, any work related, family related stress? Do you take a recreational drug? Which drug? How do you take it? How often, and since when you have been taking it? And if patient is injecting, ask like, do you share needles? That's very important. Sexual history is very, very important. Again, ask, are you sexually active? Are you in stable relationship? Do you have any other partner? When you had do you practice safe sex? When was the last time you had unprotected sex? You will be asking about few more things, asking about what route of sex you prefer. Do you use sex toys? That you can ask. You can ask like, what's your sexual preference, your sexual orientation? And if the patient had previous STI or PID. So all these things you will ask in sexual history. We have got social history. It has got its own relevance. Travel. Have you traveled recently? Maybe patient has traveled to some endemic areas, and that's the reason patient has got this infection maybe. Occupation. For example, patient is working in aniline dye factory, so they are more prone to have bladder cancer, right? Living condition. That's also very important. Like patient may be living in a very congested environment. Or for example, patient is, we are discharging the patient, so you have to see where this patient is staying, and it might not be safe for the patient to go home because all the arrangements are not according to the patient's need. So that's the thing we have to be very important. We have to give very importance. And once you're done with your whole history, there's one more thing you can do. Is there anything else that I should know? That's very important. Is there anything else that I should know? Is there anything else that I should be knowing? If you had got very good rapport with the patient and you are missing something, and you will see that your patient will help you a lot. Your patient will help you in getting that finding if you're missing something, right? So that's very, very important. Patient concern, that's very important. And all the PLAB2, what you have to concentrate on the patient's concern, because patient came to you because patient has got some concern. So make sure you acknowledge, you take care of all the concern that your patient has got. And it's not only about the medical thing, not only about the medical treatment. You need to be concentrating on impact of the patient illness on the patient life. Patient has got some illness, patient has got cough, patient is feeling tired, and it's going on maybe like say for last 6 months. So you need to explore how this illness has affected patient daily routine, how this patient has affected his life. Maybe patient is feeling tired for last 5-6 months, and now patient is saying, doctor, I'm like really stressed about this thing because I used to help my children in their homework, I used to help my wife in some household work, but now I'm just feeling tired, I can't do anything, and I just feel very depressed because of this. So if patient has got any illness, you need to ask how this illness has affected your life, and usually it will be with some chronic problems. It's not with the acute problem. If patient has got chest pain and you're asking how this has affected your life, it will not make much sense, because acute condition is not putting much impact on the patient life, because if they have got acute illness, they'll directly come to the hospital and they don't have time to think how this will gonna affect my life, isn't it? But chronic illnesses, yes, definitely you need to ask. Maybe they're not able to go to work, maybe they're not able to spend time with their dear ones, so it's very important to know the impact of the illness on the patient's life, right? And after that, how we gonna put it, once you're done with your history, what you need to do, we have to tell the patients about the management plan and everything. So there is a particular order that you have to follow. So that's the order that we are going to follow. So after finishing your history, you have to do examination. So examination will be your general physical examination. You'll be mentioning that I'll be checking your vitals, and we will be doing specific examination. Specific meaning it depends, like maybe it is the examination of the chest, maybe it is the examination of the heart, maybe it is the examination of the joints. So it depends like which examination, what kind of station you're having. If you're having a station of cough, so definitely chest. If you're having a station of chest pain, so definitely you'll be doing a heart examination. If you're having a patient of like joints pain, so joint examination. If you're having some eye problem, eye pain, eye discharge, so of course you will be mentioning about eye examination, right? So in a few stations you'll see like you may have to do this examination depending on the need. On some station maybe your dear examiner will give you some finding, right? So after examination you need to mention about initial investigation. These initial investigation will be like those investigations which can be done quickly and which can be done in any setting, because most of the scenario you will see you are in GP, and GPs, they can do only limited investigation, they cannot do everything. So here we are talking about routine blood, like full blood count. We are talking about maybe blood sugar. We are talking about say ECG. We are talking about x-rays, chest x-ray maybe. We are talking about say urine dip. So you are talking about these investigations. For example, patient coming to you with some problems, say some cough, and you might be thinking, okay, let's do full blood count. So these things can be done. For example, patient is coming to you with the burning sensation in the urine. So before you say, you're thinking it's UTI, urinary tract infection, but don't you think if you have got urine dipstick finding, then you'll be in a better position to disclose it. If you have got leukocyte positive, if you have got nitrates positive in your urine dip, then it's easy for you to say it is UTI, urinary tract infection. So before you disclose the diagnosis, make sure after taking history you have got examination and you have got initial investigations with you, right? So this is really, really important, examination and initial investigation, right? Because after examination investigation, like maybe examiner will give you some finding, and on the basis of those findings plus on the basis of history, you'll be in a much better position to give your diagnosis, right? But before you disclose and explain your diagnosis to your patient, there is one more thing which we say ICE. It's idea, it is concern, and definitely it is expectation. Right, so it's very important, because if you ask the patient like and put all the positive findings here and ask the patient, do you have any idea what's going on with you? Even if you don't know about the diagnosis, proper diagnosis, maybe your patient will help you out. It's happening quite a lot, like patients, the simulators, the examiner, they are there to help you out. They want to pass you, but it depends how and if you want to take their help or not. So ICE is really important. So you can do ICE. Do you have any idea what's going on? And patient might be telling you, doctor, is it this? Is it cancer? Is it something serious? So patient will give you some idea, because patient might have Googled it. Patient might have read about the symptoms, and maybe he's having some concern about that particular thing. Maybe patient is expecting something at this point. So it's very, very, very important to do ICE in this station, right? Any station actually you can do ICE. After that, you can disclose and explain the diagnosis. On the basis of history, examination, and investigation, disclose your diagnosis. After that, what you do, you need to explain about the examination and investigation finding. For example, examiner has give you some examination finding and you have got some investigation finding as well. So after disclosing the diagnosis, you're saying that you have got a condition called, say anything, you have got a condition called maybe giant cell arteritis, but how do you say how you are making the diagnosis? Maybe examiner has given you some examination and investigation finding. Maybe examiner has given us ESR CRP, which is high. So say like you have got a condition called giant cell arteritis because in the investigation we have found that ESR CRP, the inflammatory markers, are raised. Meaning explain the examination, explain the investigation results to the patient. Right. Sometimes you might not be having an examination and investigation. So in that case, what you do, still you have to disclose the diagnosis. You can say you might be suffering from this condition. From my assessment, from my history, what we are suspecting, you might have a condition called giant cell arteritis. Again, you are telling that this is our most probable diagnosis. Right, so that's how you will disclose and explain the diagnosis. And if you have got any examination investigation finding, based on that you have mentioned the diagnosis, so make sure you explain those examination investigation finding to your patient, meaning you are giving the reason of the diagnosis. You have said you have got giant cell arteritis. Why? Because you have got pain. Where? Pain in that head, which is here in the temporal area. Right, and moreover we have done some investigation where we found ESR CRP, which is an inflammatory marker in our blood, that is also raised. Then you can mention about the further investigation. If you have got any further investigation for anything, you can mention about it. Right. So for example, like you have got a case of like tummy pain, tummy discomfort, patient has got diarrhea as well, and you have done some routine investigation, but now you want to do say endoscopy or colonoscopy. So you can mention about further investigation. For example, patient is here for cough and you are thinking it might be cancer and you're planning to do some invasive, some big investigations like bronchoscopy. So that will be coming under further investigation. For example, in giant cell arteritis, you're thinking about doing temporal biopsy. You can mention in further investigation. So now tell the patient, as we have diagnosed you, but we want to run some further investigations as well to confirm the thing or to maybe plan treatment depending on the station. So we mention about that further investigation. And then we need to mention about the management plan. We need to mention about the treatment plan. So treatment is symptomatic and specific. That's very, very important. There is symptomatic and specific treatment. For example, just take any station, you're dealing with the giant cell arteritis. There is symptomatic treatment as well. Patient is coming to you because of pain. So what's your symptomatic treatment? Painkiller. Patient is coming to you with nausea, vomiting. What's your treatment? Antiemetic. So that's your symptomatic treatment, which is must. Make sure you are mentioning symptomatic treatment first, because when patient comes to you, what is the expectation of the patient? That you will give some painkillers, you will give me something for nausea, vomiting, isn't it? And then of course you need to mention about the specific treatment as well. Like for giant cell arteritis, we know the specific treatment would be steroids, right? So accordingly we'll go symptomatic, specific, treatment. And the treatment would be medical and non-medical as well. So you'll mentioning few things medically, and of course you will be having non-medical stuff as well, like you may be talking about smoking, alcohol, diet, physical exercise, and other things which are the risk factor, but plus the medical treatment as well. And which one you will mention first, medical or non-medical first? It depends actually. It depends on the case. If you see the patient is in acute distress, acute problem, then you may be going for the medical treatment first. And if you see it's a counseling station simply, then you might be giving non-medical advice first, and then you will go for medical one. Right. And you have to see admission, whether you are admitting the patient or not. That's very important, because like when patient is coming to the hospital, maybe in the A&E, so you have to see where you are keeping this patient. Are you keeping this patient in the A&E for a long time? You're keeping him in observation, you're keeping him in the hospital, or you're discharging the patient. So you have to be very careful. So you have to see, if you know, if you have admitted a patient which is not supposed to be admitted, this is fine. It's not a blunder, isn't it? You have admitted a patient, but you would have discharged, but it's not a big deal. Your consultant, your senior will come and tell you, doctor, this patient we can discharge. So that's fine. You are being a safe doctor. But for example, you have discharged a patient who was supposed to be admitted, then it is a big blunder. You cannot discharge a patient who's supposed to be admitted. Maybe patient was a patient of ACS, patient came with chest pain, and you have done the ECG. Maybe there was no change in the ECG, but maybe the troponin level was raised, and you didn't wait for the troponin, and you have discharged the patient. So what you did, you are not a safe doctor. So that's very, very important. So you have to see, we are discharging or admitting the patient. Make sure you are being safe doctor. If you are not sure whether to admit or discharge, take the help of your senior, or maybe keep the patient for some time in the observation and call your senior. That's the best approach, right? We have to show we are safe doctors. And GMC says like every management plan includes follow-up and warning sign. So don't miss the follow-up with the occupational and physiotherapist as well, like occupational therapist and physiotherapist. OTPT review, it's occupational therapist, like if you are having a case where you did the surgery, so we need to see the occupational therapist, our colleagues, they have to see if the facilities at home, if they are okay, if patient can go home without facing any problem, if they can manage on their own or not, or if there is any need to make some changes in the house. So that will be taken into consideration by the occupational therapist. And a physiotherapist, like for any exercise or something, like a patient has got any like joint pain, so maybe some exercises and all. So that's the review, OTPT review. Follow-up is must. You have to come for the follow-up. And warning sign, if your condition gets worse, make sure you come back to the hospital. So last few seconds, last 10-15 seconds, make sure you're always keeping for follow-up and warning sign. That is must. Please always come for the follow-up, and if your condition gets worse, come back to the hospital. These two lines are must in actually all the station. Follow-up and warning sign are must, right? And in the end, you can always say leaflets and pamphlets as well. You can always say like we're going to give you some leaflets, and you can have some pamphlets. NHS, GMC, NHS, actually they have got leaflets and pamphlets for everything. You can give leaflets, pamphlet, not a problem, but make sure you don't refer the patient to the internet. That might be a tricky thing, because internet, for example, you are searching something on Google, maybe just cough, causes of cough, it might say cancer straight away. It might be a simple cough, and internet will scare you by saying cancer. You have got headache, simple headache, and if you Google it, it will say brain tumor. You will be stressed, they will be stressed. So GMC says try not to refer the patient to the internet for the problem, but you can offer leaflets and pamphlets, and NHS has got leaflets and pamphlets for most of the things. So patient can go, they can read about it, and if they have got any concern, any problem, they can definitely come back, and we can definitely explain these things to the patient. So this is something in brief about the whole of this history taking, the summary of history taking examination and everything, and this is what you need to do in 8 minutes. So make sure when you practice with the 8 minutes timer. That is must. If you practice with the timer, the things will be easy for you, right? Because it's not about knowing everything, it's about knowing the things and telling the things in 8 minutes, and try to do maximum. You might not be able to do everything, but try to do maximum thing in those 8 minutes, right? Thank you.